Good day, everyone. Let me just introduce myself first. My name is Ethan Jero Rezon Seguin, a first year college student from Manila Central University with a course of major in marketing management. Our topic for today will be birth control methods and the importance of using contraception. This topic will be about practicing safe sex and the do's and don'ts of it. I am happy to educate you all. So for the next slide is, as you can see, these are the table of contents. We have 5 chapters in regards to this lesson. First one is introduction. Second will be the importance. Third will be the methods of birth controls. For the fourth one is the effectiveness. Lastly, this will be for the benefits. So kindly listen from what I am saying here. Okay, thank you so much. Introduction. The use of contraception helps you to determine how many children you may want to have, as well as the timing of your pregnancies. It also has other health benefits that can help women who have PCOS, and it prevents you from having STDs, and it stands for sexually transmitted diseases. Let me just turn back from what I'm saying a while ago. For the word PCOS, it stands for polycystic ovary syndrome. It is a condition in which the ovaries produce an abnormal amount of androgens, male sex hormones, that are usually present in women in small amounts. The name polycystic ovary syndrome describes the numerous small cysts, fluid-filled sacs that form in the ovaries. So, what is birth control, guys? Birth control is a method or device that are used to prevent pregnancy. It has other benefits, not just to prevent unwanted pregnancies. The importance of using such a contraceptive is to prevent unwanted pregnancy and having any kinds of diseases, preventing mortality rate. Effective contraception improves maternal health. Its awareness enables women and men to limit family size. It safeguards individual health and rights and improves the quality of life of couples and their children. So, practicing safe sex is a must for everyone. For everyone who is planning for family size. Of course, to avoid any kinds of unintended pregnancy that may lead to abortion, it is best to study about sex education. Next slide will be the importance of using contraception. This topic may be controversial, but This is to educate everyone of all ages to have a basic understanding of each contraceptive. Either the rich or not, everyone is privileged to have this knowledge. As a matter of fact, using this will prevent to have unwanted pregnancies and can also avoid certain kinds of diseases such as HIVs, AIDS, STDs, and etc. So for the first one, birth control method, it stands for intrauterine device. Acronym is IUD. Basically, a device inside your uterus. It is a tiny device that puts into your uterus to prevent pregnancy. It's long-term reversible and one of the most effective birth control methods out there. Second one is birth control implant. Birth control implant is a tiny thin rod about the size of a matchstick. The implant releases hormones into your body that prevent you from getting pregnant. Later on, we will going to tackle about its advantage and disadvantages of a certain contraceptive method. Third one here is a withdrawal method that is commonly used by couples or of course everyone likes this kind of method. This is a way to prevent pregnancy by keeping semen away from the vagina. Withdrawal works best when you use another birth control method with it, like a condom, but I suggest you to uh, avoid this kind of method, which is the pull-out method, because it is risky and dangerous. It can lead to diseases or it can lead to unintended pregnancy. Next one is all about condoms. Condoms are thin, stretchy pouches that you wear on your penis during sex. Condoms provide greatest protection from both pregnancy and sexually transmitted diseases. They're easy to use and easy to get. Birth control pills. So, for the birth control pills, these are a kind of medicine with hormones. Birth control pills comes in a pack and you take one pill every single day. The pill is safe, affordable, and effective if you always take your pill on time. So, time management is really important for this kind of birth control pill because when you skip the time, this may be not effective anymore. Birth control or vaginal ring. You wear a small flexible ring inside your vagina and it prevents pregnancy 24/7 by releasing hormones into your body. The ring has lots of other health benefits too. When do you put a vaginal ring in? You can start using the birth control ring as soon as you get it, any day of the week and any time during the day of your menstrual cycle. If you put your first ring in with birth control shot, it is a very effective method of birth control. It works best when you get the shot every 12 weeks. When used perfectly, this birth control shot effectiveness is more than 199. It's more than 99%, meaning less than 1 out of every 100 people who use it will get pregnant each year. But when it comes to real life, the shot is about 94% effective. So sometimes people forget to get their shots on time. This may be for the disadvantages. And also for the birth control patch, it is a safe and convenient birth control method that works really well if you always use it correctly. You wear the patch on certain parts of your body and it releases hormones through your skin that prevent pregnancy. The patch has lots of other health benefits too. Diaphragm helps you prevent pregnancy. It works as a barrier that covers your cervix, stopping sperm from joining an egg in order for a diaphragm to work at its best. It must be used with a spermicide, cream or gel that kills sperm. When used correctly with a spermicide, a diaphragm or cap is 92 to 96% effective at preventing pregnancy. You can put in a diaphragm or cap with spermicide anytime before you have sex. Morning after pill is a type of emergency birth control emergency contraception that used to prevent pregnancy for women who've had unprotected sex or whose birth control method has failed. This this is commonly used for people that forget or wasn't able to use a contraceptive before or after sex. This is also called as a plan B contraceptive. And for next one is fertility awareness. Fertility awareness are ways to track your ovulation so you can prevent pregnancy. FAMs are called as natural family planning and the rhythm method. This is the knowing and recognizing when the fertile time when a woman can get pregnant. Women tend from time to time check their menstrual cycle. And this is a necessary kind of method to look out for. This can also make women and men understand better when the fertile period is and how contraceptive affects menstrual cycles and ovulations. Next one is for the vasectomy. This is commonly used for males only. It is a simple surgery. It is a simple surgery done by a doctor in an office, hospital, or clinic. The small tubes in your scrotum that carry sperm are cut or blocked off, so sperm can't leave your body and cause pregnancy. This is 100% accurate when it comes to impregnating to a woman. This will be the end of BO when it comes to getting a girl pregnant. It can prevent pregnancy 100%. And just like from the one a while ago, this is sterilization. And yeah, it is a safe and effective surgical procedure that permanently prevents pregnancy, also called as tubercle ligation. These are the effectiveness of each contraceptive methods that we've spoken a while ago. So let me start with the IUD first. Advantages of The advantages of it is easy to use, highly effective, no interference, and no need of repeated action. Disadvantages of it is risk of pelvic inflammatory disease, not recommended for women without any child, and inserted by healthcare personnel can cause heavy bleeding and pain in women. And another one for the birth control implant has a 99% effectivity. Disadvantages of it: you may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Sterilization, or also called as tubal ligation, this is permanent. As you can see, you're not getting pregnant anymore, so this is a huge advantage. Removes fear of pregnancy, of course. Any woman will eliminate fear of getting pregnant because of this. And for the disadvantage of it, this will be irreversible and it requires surgery. For the vasectomy, hello. For the vasectomy, it has a 99% of effectivity. It is also permanent and removes fear of pregnancy, and that is for the advantage, just like a while ago. And its disadvantage is generally considered reversible. So when it comes to getting pregnant, it doesn't really the word pregnant doesn't exist after you are getting vasectomy. Birth control pills is a 91% effective. Advantages of it usually makes your bleeds regular, lighter, and less painful. And the downside of it may affect mental health. It can lead to mental illness, something like that. And also for the physicality looks, you may gain weight if you're taking birth control pills moderately. And for the birth control patch has a 91% of effectivity. Birth control vaginal ring. So advantages of it is effective and reliable when used as directed. Disadvantage of it are side effects, spotting or bleeding between periods, sore breast, nausea, or headaches. But these kind of side effects usually go away as long as after 2 or 3 months. Diaphragm is 88% effective. Advantages of it is reusable and relatively inexpensive. It may be small and easy to carry. It rarely hinders the sexual experience. And for the disadvantage of it, spermicide applied to the diaphragm may damage the cell lining the vagina, causing increased risk of contracting STIs such as vaginal irritation. In short, no health risk for the advantages, helps protect against some STDs and cervical cancer. Disadvantages of it, fit by healthcare personnel, may be embarrassing to use and inconvenient to clean, store, and carry. Morning after pill, it has 87% of effectivity. Advantage, advantage of it. There might be a chance of you preventing pregnancy, but the disadvantage of this one, it still has risks. And also for the condom, 85% of effectivity. Of course, condom can prevent pregnancy, but for the disadvantage of it, it may get destroyed, if you know what I mean. And for the second to the last, withdrawal, 78% effective. So this requires a lot of skill and a lot of practice to, yeah, perform such a withdrawal or pull out method. But I suggest you guys to use like a real contraceptive method, because withdrawal method is still risky to do it. And also for the fertility awareness, 76 to 88% effective. Advantage of it, it gives you a lot of knowledge for your fertile period. But yes, yeah, advantage of it, it requires you to know where when is the best time to have sex. But for the disadvantage of it, there is still a risk to get pregnant, something like that. The benefits of using contraceptives, as you can see, it regulates menstrual cycles, reduces your risk of uterine cancer, can help with menstrual migraines, and it can prevent causes of unwanted pregnancy. It reduces your skin of ovarian cysts. And that is all for today. Thank you guys for listening to my lesson here. And yeah, I appreciate you guys. Thank you so much. God bless everyone. Bye bye.